Hi, boys and girls. This is Ken Bohannon again, and I'm continuing in part two of my conversation with you in reference to metallosis and trunnionosis and the complications which arrive in your system as a result of the spread of cobalt poisoning and any other poisonings that you receive as a result of a hip implant. Hip implants are a wonderful thing. Thousands and thousands of people, and I don't know what it's reached in 2016. It may be up to 750,000 a year for people who get hip arthroplasty. So if you have a hip implant, for most people it goes well and you'll be fine, and your system, you may not have any adverse reactions as a result of the prosthesis which is placed in you. These prostheses have various metals in them, and chromium, and cobalt, and titanium, and they're supposed to last anywhere from 10 to 25 years, and that's a good thing. But sometimes there's complications, and a small fraction of them, and it can amount nationally to thousands in the United States each year, where from the prosthesis there are certain failures. And the failures may be mechanical, or they may be chemical. And so that's what I want to talk about today. In my case, beginning well, I've had the prosthesis since 2014, but began to have reactions to it 6-7 months ago, where I had increased feeling of pain and began to get some night sweats, and began to have some muscle problems in my sacrum, and so piriformis muscles, abductor, your abductor muscles, all the muscles that build around your sacrum, and the muscles which attach coming around from your back, the piriformis, your abductor and your abductors, and the associated nerves which are underneath these muscles. The reaction that you have from the pressing of the edemas which are produced from the adverse reaction, tissue reaction to the metal particulate and or ions which break off from the prosthesis. You're always going to have in wear and tear, whether it's plastic or metal or whatever, you'll get microparticulate, and these particulate or debris produce adverse reactions in your tissue. And in the case of a hip prosthesis, the adverse reaction is called ALVAL. And ALVAL is a septic lymphocyte-dominated vasculitis associated lesion. So when you receive, if you're having a problem, your surgeon will recommend blood test for possible contamination from the particulate to determine whether you have a metallosis or a trunnionosis. And then it can go forward into deciding whether you're going to need a hip revision. Obviously, if you're having a lot of pain and night sweats, obviously you're going to take a close look at that, and you'd better be very proactive with it with your surgeon. Sometimes the surgeons do so many of these that it's impossible to give due attention to all the patients out there. So I did mention the ALVAL, and what you'll have is, if you're moving forward towards a hip revision, then you're going to have a MARS MRI, and the MARS MRI is a metal artifact reduction sequence MRI where you have metal specifically for metal prosthesis, and these can determine the amount of edemas you have, your adverse reactions which occur to your tissue. So what happens is you're going to get inflammation around that prosthesis, and that inflammation is going to produce swelling, obviously with edemas, and that swelling is going to press on your, is going to move your muscles and your nerves. As your edemas move your muscles, they press on the nerves, and obviously the nerves are transferring the pain. Ladies and gentlemen, boys and girls, as you consider hip prosthesis and/or hip revision, keep in mind these complications. You can have night sweats on a regular basis. You can lose a lot of weight, a lot of pain. Obviously, to get around before you have your hip revision, you need crutches. You're going to need a cane, maybe. You're going to experience, for the most part, a lot of pain. Things you can do to mitigate it, for it. You can receive ibuprofen, other pain medications recommended to you by your physician. Try to do this once you start receiving this pain. Once you start noticing in this, whether it's an immediate or a slow process, in the case where it was with me, be proactive, because just to get into surgery, there's so many hip revisions going on in the United States right now. It takes a while to get in. So at least, unless you're in your deathbed, you're going to wait, and you're going to have to deal with the pain. So keep that in mind. You can go online and look up the FDA for their regulations related to hip prosthesis and outcomes and adverse reactions, and go to the National Institutes of Health. So so between the FDA, which regulates all this, and your research at the National Institutes of Health, are excellent sites and can answer any and all questions for you. As a lay person, I've had to study this whole process to figure out what's going on with me. And another thing, if you want to mitigate the pain, make sure that you have a heating pad and ice packs. And it would be nice if you have a sauna and a swimming pool, a heated swimming pool, and/or a steamer. If you have a steam room or a steam shower, this way, as the ions, as the particulate, whatever you're allergic to, and you're typically allergic to the metals in some form or another, the plastic, but particularly for the metals, as they leach out, you're going to get allergenic responses. So your lymphatic system is cleaning them out, so that's why you're getting night sweats. So if you can get in a sauna or a steamer, this will help to relieve a lot of that, because this lymphatic system will rid itself as much as it can. So you're really, by being proactive with getting into a heating situation with a steamer or sauna, getting rid of a lot of the metal ions. Ladies and gentlemen, I'll continue this with you at another time. This is part 2 and a continuance of what we've been discussing with hip replacements and then possible hip revision. Thank you and have a great day. This is